Let's get started with our day. Our first speaker, please put your hands together for Brian Hazelgren, founder and CEO of RX2 Live.
Thank you so much. Sure appreciate the introduction. Good morning, everyone. So good to be in your presence today. We have just a brief presentation I wanted to share with you. And before I actually get started, I thought we would be coming to some cooler weather. I'm from Phoenix. So yesterday, it was hotter here than it was in Phoenix. But it was good to be in Las Vegas last night and be with my team. Part of our team is here, an incredible team that you're also going to meet throughout the day. And then before I actually get started, I want to talk to you a little bit about a quick story about my two little girls and why I'm actually standing on this stage. 20 years ago, we had twin daughters. And interestingly enough, those twin daughters were our second set of twins. Probably explains why I don't have any hair left today. The other thing was, when we found out that the girls were going to be born premature, we had to actually stop the process at 23 weeks. My wife had to be on complete bed rest. Bought her another 5.5 weeks, and when they were born at 28.5 weeks, they were born at 1 pound 10 ounces and 1 pound 12 ounces. So when you've held a child that small, your perspective on life completely changes. And so back in 1999 is when this was. Fast forward a couple of years, I got a phone call from a friend who asked if I'd help them rewrite their business plan because they were generating income streams, new income streams for children's hospitals. And at the time, I remember thinking, man, I'm really busy, but none of that matters now because I remembered what a children's hospital did for my cute little girls. They saved their lives. They also saved my wife's life, who flatlined on the operating table at the time. Long and short of it is, that began my journey back in 2003 in being directly involved with healthcare. Because what we ended up doing is we got involved with this particular organization and started generating new income streams for children's hospitals. What we learned is that as we would go through the discussion points of what we all wanted to accomplish, we all had the same common goal. How do we provide better health care for children? How do we relieve some of the stress that the parents have? So fast forward 7 years later, we ended up generating $1.3 billion for 170 children's hospitals. And I was hooked. I was in the healthcare industry and haven't left ever since. Today we run an organization called RX2 Live. We started this company several years ago. We have an amazing dream team that works tirelessly in providing better healthcare options to everybody, not just the children in this case, but everybody in the healthcare system. So today I'm just honored to stand before you to tell you a little bit about what we've done, share some success stories with you, and I just, we're all brothers and sisters in this journey as we go down the path and trying to figure out how do we provide better health care. Let me show you a couple of things that are interesting for us to learn about. Physicians have literally lost, in the last 5 to 8 years, they've lost 40% of their income stream. My doctor, Timothy Bryan, he has to see 35 patients every day just to keep the lights on. Our physicians are overworked, they're overwhelmed, they're even depressed, and they're losing hope. We have a partnership with an organization here in the U.S. that brings us to over 300,000 physicians here, and that is a common theme. That last bullet point of being depressed and literally losing hope is a common theme with those 300,000 plus physicians. Okay, next, chronic illnesses are costing U.S. businesses $1 trillion. Several statistics that came out from the government about 2 years ago made the claim that it was around $600 to $700 billion, but then you have to add in the unproductivity of employees because they have to show up at work at 40 or 50% capacity, otherwise they'll lose their job. So we feel like workplace wellness isn't working anymore. We created a disruptive program for that as well. I'm going to share that with you in just a minute. And then the last bullet point I wanted to tell you about is another market that we're involved in, and that's with the senior population or elder care. There's about 12,000, according to CMS, the Center for Medicare and Medicaid Services, there's about 12,000 people that turn 65 every day. It's like interest, it doesn't sleep. There's still more people coming into the system. And what we've learned is that there are about 83,000 facilities in the U.S., but it's still not enough because that population continues to grow. The share of the U.S. population of 65 plus currently today is around 17%. Over the next 30 years, that number is expected to be around 22%. That number would represent 77 million people. We don't have enough space for them, nor do we have the proper services in place. So we thought we'd do something about that and be a little disruptive. So we created 3 vertical markets to help doctors drive new income streams with the right types of services, and we also want to help them provide better patient outcomes for their patients. We can do that through a combination of technology, a lot of smart people, and the right products and services. We think that we can help companies lower their healthcare expenses. In fact, let me rephrase that. We know we can help companies lower their healthcare expenses and their workers' claim costs. We know that we can help increase the productivity of those employees, and those that are showing up that are 40% capacity when they show up during the day just because they have to be there or they lose their job, we've been able to affect that and increase that and make them more productive while they're at work. So we've actually put a new model in place for the elderly, for elderly care, and I want to show you what that looks like. So we actually have 3 vertical markets. We decided that we'd create 3 specific vertical markets. Currently today we have about 20 products and services that we provide in those 3 verticals. The reason why I want to speak to you today is because several of you in the audience hopefully might look at our model and say, you know what, we may want to partner with you all. And we're looking for additional partners to provide better healthcare options and systems for patients, for employees, and residents in the elderly care market. Could you advance? There we go. The physician's practice growth area, these are some of the services that we currently provide. We have lab services, we have neuropathy biopsies, we have microcurrent therapy, we have an amazing weight loss program that's won a lot of awards. We even have a behavioral health screening system. A couple years ago, we learned that Congress was considering putting some funding together for the treatment of opioid addictions, or in other words, after the fact. They actually passed a bill last year and put $6 billion into the system specifically for the treatment of opioid addictions. Our philosophy was, why don't we create a system, a program that detection can happen early on? That we can have technology, a software platform, a little tablet, have that available for the patients who usually don't get asked the questions when they go to the physician's office. Now those questions get asked right as they're in the waiting room or in the exam room. That's the first thing. The questions actually get asked, number one. Number two, that now becomes a billable event for the physician. They actually can drive new income with that particular program. All those services and products that you see on the board there drive additional income back to the practice. That's our primary goal. How do we drive additional income? How do we help our physicians retire well? And how do we also provide continuing medical education credits? So let me give you a couple of testimonials from some of our doctors and office managers. This is Dr. Jensen. He says, we are bringing in $11,000, around $11,000 per month using your CCM platform. That's chronic care management platform. Let's see. Let me see if I can move the batteries here. There we go. Dr. Anderson, we perform about 136 behavioral health screenings in our system each month, and that brings in $14,000 in new income for us. The light therapy service that you all offer actually brings in somewhere around $150,000 according to Brooke. They treat about 12 new patients every day. They didn't know what this was. They didn't have this in their practice a year ago. Now they have that. It drives a new additional income stream to the practice. And then the last one here, we're seeing incredible results from your microcurrent therapy. That's actually healing the tissue a whole lot faster than traditional methods. So we bring this disruptive technology to the doctors, they utilize it, better patient outcomes are seen, and additional revenue is being driven back to the practice. That's a huge win. We love being involved in this market space. Next area. This is our workplace wellness area. We actually created an app in partnership with LifeWorks, and we take that out to the world and help employees and their leaders in the company to kind of look and see how they're doing with their wellness program. We think that it's a lot more in the wellness programs than to just have a system where they give a discount to the gym to the employees, they remind them in a newsletter to eat better and work out more, and maybe once a year there's a workplace expo or a wellness expo that's provided at the workplace. We think there's a whole lot more to that. These are the types of services that we provide for our employees and the clients that we have throughout the world. One of those is even a very simple one right there at the bottom right, the wellness expos. We actually move that outside of the environment of the company, and it's completely different. We actually have about 70 different vendor partners that work with us, and they put those wellness expos on. And the whole key there is what we constantly drive home is how do we lower the healthcare expenses for the company and increase the productivity of the employees. That's our primary goal. It's a great little system. Let me give you some testimonials from that. We've been able to track how much we are saving our employees, and it's about $2,352 annually. Stress management is a big deal for us. We are able to effectively manage stress for optimal health, well-being, and productivity using your app. That's an HR director. Effective communication is very important for our organization, and your app allows us to include both verbal and nonverbal behaviors and even help increase the communication flow. I'll add that too because I know Suzanne said that earlier as well. Gamification is really helpful to get our employees engaged in using the app and the other services that you offer like weight management and mental well-being. This is an excellent platform. We feel like gamification inside the app, you got to make this fun. You got to have it a little bit fun for the employees to stay engaged, and we do that through our gamification platform that is also built into the app. Sorry, this is... Could you advance the slide one, please? Thank you so much. That's just a quick look at our app. Some of the areas that what it looks like. It's very convenient, very easy for the employees to use. All right. There we go. So, elderly care. Let's talk about our third vertical market. Now, you'll notice when you look at that screen, that's pretty similar. In fact, it's exactly the same as what I showed you earlier for our physicians' practice growth area. The reason why it's the same is because we've been working with CMS now since 2014 when we built the platform for the chronic care management system for Medicare patients. What we did is we went back to them and said, you know, we've got a couple of organizations that own elderly care facilities, assisted living, skilled nursing facilities. They'd like to know if some of our services are covered by CPT codes through CMS. And the answer was, well, let's look at it. And we came up with 33 specific codes that we could take back to the senior care facility and showed them if you engage us on these particular services, you can actually bill Medicare for those services. That was a couple of years ago. Today we have over 70 CPT codes that we can drive new income back to those organizations who own senior care facilities. And it's through all of those things that you see on the screen there. So Long and short of it is, the elderly care market is advancing rapidly. If you look at that graph, that goes back to 1950. The heading there says that the U.S. population of 65 plus and older, or 65 and older, in 1950 was about 8% of the U.S. population. You can see the trend keeps going up. Today it's right around 17%. Like I mentioned earlier, it's going to be about 22% by the time 2050 comes around over the next 30 years. Ladies and gentlemen, that actually represents 77 million people here in the U.S. that'll be on Medicare. So we're doing something about it now by providing a disruptive system so that we can literally drive new income streams to the elder care facilities and again provide better patient outcomes. So here's some quotes from that particular segment, or market segment. We want to build the model together with you and take it to all 83,000 facilities in the U.S. It's that important to us. This is a quote from an executive director in Florida. I was giving a presentation to some of our people a little while ago, and one of our gals stood up and said, "Brian, I just want you to know that when this executive director who wouldn't let me come and see them heard that we had signed a deal with a big client that they knew of," this is their quote, "Wait, did you say they've come on board with you as a new client? Well, then we need to come on, you need to come in and see us because we don't want to be left behind." Here's another quote from Dr. Nazir. "We always need additional sources of income. We also need you to help us with your service offerings because we're a little overwhelmed with 40,000 patients in our system. You guys have a nice little platform that'll help us achieve that. If you can offer CCM, or chronic care management, behavioral health screenings and lab services to our senior residents, this is something that we've been looking for the past 5 years. We're already engaging many of our senior care facilities because they don't know about it. So we're in the education business as well. Our job is to educate the doctors, the business owners, and the senior care directors of how we can drive new income and provide better outcomes. So we have a disruptive twist. What if we were to go out and create all these markets and have the markets already in place and then create the demand, but then work with partners to plug their products and their services into those markets? So far, that's been working really well for us, and we're very excited about it. In fact, we were named you'll see later today, we were named as one of the top 50 companies in healthcare. Again, we're very grateful and very honored to be a part of the International Forum on Advancements in Healthcare. IFAH has been a new partner for us to look at. We were just very honored to be considered even for the award. But I want to show you what our scores were. I want to show you a little bit about how this all came about. So overall outreach, we scored an 87. Industry impact, we scored an 88. But I just want to call your attention to those little boxes at the top. Total number of different people exposed to your product and services. That's where we created the 3 vertical markets. The impact of your product and service in the corresponding sector. Next 3 is spirit of innovation, future readiness, and market demand. The spirit of innovation, call out that particular box, new perspectives and solutions to industries that are being applied to. Under future readiness, address the growing demand and population without compromising quality that is delivered. And finally, demand for a given product or service in the corresponding industry. That's what we've been able to do. That's why we've been able to find a little bit of success along the way, and more importantly, our mission when we started this company a few years ago, was how do we get to positively affecting 1 million lives? And when we hit that, then let's go to the next goal, and that'll be 5 million lives. And then we'll go to the next goal, that'll be 10 million lives. So we're on a mission now to create positive outcomes for the patients and the employees, increase revenue streams, and also help reduce the expenses at our corporations that we work with. So this is out of a little book that I wrote. Not sure why that got all bundled up. That's when we always have, when we create the presentation and keynote, and then we try to convert it to PowerPoint. it kind of jumbles things up. Anyway, I want to draw your attention to this. Positive people make things happen because when one thing does not work, which often we see in our industry, in the healthcare industry, when one thing doesn't work, we try another way, and then yet another way until we actually find out what works. Second one there, positive people make things happen because they live in a big world with plenty of things for everyone to go around. We believe that wholeheartedly. We believe that as we go through this life together, we can make a positive difference. We can bring technology together. We can bring capital. We can bring products and services to literally affect the healthcare system, at least here in the U.S., and hopefully throughout the world. We hope that you are passionate like we are, because that last bullet point there, or that little tagline, the passion to care and the spirit to lead, we felt like if we were disruptive in a good way, which we hopefully are achieving that, I think we are. If we're disruptive in a good way, then we can create new demand, we can create new products, new solutions. We're in the business also of providing solutions. So we would be honored to have a conversation with all of you in the room. I've got my team here, part of our team here with me. If they would stand up, they're right here up front. This is Michelle Harthill. She's our Chief Marketing Officer. Raise your hand, Michelle. This is Garrett Blood, our Chief Operating Officer. And Scott Peterson, our National Sales Director. If we go throughout the course of today, the reason why I want to introduce my team, number one, I love them to death. They're amazing human beings and they're incredible hard workers. But number two, if we all get kind of busy, you know who you can also speak with today if you want to look at partnering with us. Once again, I'll wrap up and I'll just say thank you so much for having us here at the conference, for allowing us to be on stage for a few minutes. And also, we'd love to lock arms with you, go down this pathway of healthcare together, and truly make a difference. Thank you very much. Do we have time for questions? Okay, about how many minutes do we have? Okay, about 8 minutes. Does anybody have any questions? Sorry, I can't see you very well. All the way in the back. Sorry for the glare, by the way, for you guys up front. Apologize.
Can you hear me okay?
Yes.
First of all, I love what you're doing.
Thank you.
You're welcome. A few questions. On the PGX testing, is it medicine metabolism are you looking at, or just for supplementation?
Yes.
Okay.
Yes. Medicine metabolism, exactly.
Secondly, do you have financial coaches?
No, we don't.
Which is a very okay.
That is a great question, because that little book that I showed, well, I didn't show it to you. We've got some, if you'd like a copy of that book, it's called Positive People Make Things Happen. Feel free to take that. But that's actually part of a system that we take to companies to help their employees not only find positivity in their lives, but how to maintain it. It's literally a system to follow. It's a scientific system to follow. But we don't cover enough of the financial side, because
Correct.
we do in our app, but not in the system. So we would love, if you are in that industry, we'd love to chat with you, because we're not offering that enough.
Yes. And then lastly, what I find in a lot of the new networks, physician networks popping up, telehealth, and great services, but there's not a support. People aren't understanding it. To bridge the gap of getting them to understand their mindset of still the stressors of HMO to PPO, all of a sudden Affordable Care Act, and then the anger that's happening. So I'm seeing this large gap of a group of people to actually, in physical therapy, occupational therapy, there's new things popping up there, complementary medicine. You said, I was reading over your website last night, it talked about you have new codes to cover some of these complementary methods, which
Yes.
in the past were considered to be complementary, I should say. So basically, all the aging population, there are specific codes that Medicare does cover.
Yes.
Okay.
And I will tell you, first of all, excellent question. Thank you for asking that. When we've sat across the table from executive directors or owners of elderly care facilities, skilled nursing facilities, or assisted living, even adult daycare centers, when we make the claim that chronic care management is covered by a CPT code in the senior living center, when we make the claim that we now have 7 what used to be considered cosmetic products, but they're healing in nature. They literally heal cracked feet for diabetes. They literally heal toenail fungus. Sorry to say that. It sounds a little gross. They help lower cholesterol. These are natural, 100% natural, 100% organic products. We have 7 of those products now that are actually covered by CMS with residents that are full-time in a facility.
Excellent.
So it's just, it's all the research, asking a bunch of questions. Because we have a great partnership with CMS, they helped us write one of our software programs. We can take these things back to them and say, what do you think? I mean, they've turned down many, but now we have 70 CPT codes that even the senior directors of these elder care facilities don't even know about. That's our job, is to bring that to them and educate
It's a great step. Thank you.
Thank you for your questions.
Brian, question
right
for
here.
you. I'm Justin Lee, CEO and co-owner of Berube Physical Therapy.
Wonderful.
We're in Montana, small physical therapy company in a growth pattern right now. It seems
So when I get tired of the 120 degrees in Phoenix, can I come up north?
it's a balmy 75 right
Love
now.
it.
So
Sorry, go ahead.
doesn't ever get over 100. So it seems like this is geared towards, maybe primary care or some sort of doctor's office, or
Yes,
either
one of our verticals is.
SNFs, assisted living, that sort of thing.
Right.
How could something like this fit in the PT world, such as ours, either outpatient or SNFs as well, I guess?
Yeah, when it comes to physical therapy, we work with a lot of physical therapists around the country just because we're connected either with a senior care facility or elder care facility in the market, and the doctors, and a lot of the doctors already have partnerships with PTs in their local markets. But we're not covering it enough. I'll just be flat out honest with you. We need to do probably a better job in highlighting the PT market and bringing that really more solidly into our fold, because there's certainly a massive need.
Well, and we are feeling, actually, I was part of a VC pitch on day one, and one of the questions and concerns was the downward pressure on our billing from CMS.
Right.
And we are feeling that in our industry, and we are going to need additional revenue streams. We're friends with other co-owners of other larger physical therapy companies, and that's a common discussion. How we're going to combat that or work our systems to.
We might have some answers for you. Just so you all know, about a year ago, we were actually on the path to acquire a billing company, because a lot of our providers and our senior care facilities were just saying, we get so many things rejected. In fact, we all know that the average rejection rate nationally is around 34%. We wanted to buy a company. We decided to partner with some executives that left NextGen and left Oracle, and they created their own billing solution. We started looking at their numbers, and instead of acquiring a company, we partnered with them. They literally were showing us practice that had a 36% rejection rate. Now it's 2%, because they know how to work the system on resubmitting the claims 2, maybe even 3 times, changing the modifiers so that it fits the payer on the other end, whether they're commercial or government. So we'd love to have a conversation with you about that too. And Garrett and Scott know that information really well. They're pretty deep into the weeds when it comes to that. So again, chat with any one of us. We'd love to see if we can find some solutions for you.
Great,
Thanks for that. Is that it for time? Okay, thanks everybody. Appreciate it.